Welcome back, everyone. Thank you for joining us again. I hope you had a nice stretch and bio break. We will be going for about another hour. I wanted to let you know that we will have three wonderful speakers now speaking about stress at work and possible antidotes to that stress. We will first talk to Dr. Justin Boren, and then we will talk to two researchers from UCLA, Dr. Wendy Slusser and Dr. Ted Robles. And I will first introduce Dr. Boren, and we will listen to his presentation, very important presentation, and then we will follow with Dr. Slusser and Dr. Robles. So first, let me tell you about Dr. Boren. Thank you for joining us today. Dr. Boren focuses on the way that social support networks impact the experience of coworker stress. He developed a unique concept in organizational communication called I will try this. Communicatively restricted organizational stress. I'm sure Dr. Boren, you'll pronounce it better than me, which is defined as an employee's perceived inability to communicate about a particular stressor. His work has linked this new term, CROS, to specific health-related outcomes, and he is currently developing an intervention technique to reduce employee stress in high CROS organizations. Dr. Boren, welcome to our conference today.
Thank you so much, Dr. Gogerbanks. And I know we created that term, hopefully not with the intention of making a tongue twister, but certainly that seems to have been the case. So I think cross is probably the easiest way to describe that. So good morning, everybody. Thank you for having me. My name is Justin Boren. I'm an associate professor at Santa Clara University, and pleased to talk to you a bit today about stress at work and how communication both harms and heals workers. And so, I'll spend a bit of my time today really focusing on some key areas, really stress at work. And I want to present just a bit of background from the results of the 2023 American Psychological Association's Work in America survey. I'll talk about communication and stress. It's the thing that I study. And so it's the one area that I'm particularly interested in is how can communication both, hurt workers, and certainly how can communication help workers is probably the most important thing. And so I'll look at both of those pieces, the harmfulness of communication in the workplace, and then, of course, that healing piece, which is how I want to end our discussion. So, stress at work is certainly something that is critical for all workplaces to consider. As a worker myself, I certainly recognize when I'm under stress, usually, not always. But, we do know that stress and stressful situations are those where workers are not able to cope with the demands of their job. Maybe they're unable to control the way they do their work. Maybe they don't receive enough of information, and most important for me, support, or they don't have a support network to turn to. Maybe they're having trouble with the relationships at work, or maybe they're being bullied. Maybe there's other kinds of relational issues at work. Maybe they don't fully understand their role and responsibilities, or there's some sort of conflict or role drift, or they're just not engaged when the workplace is undergoing change. And so these are certainly categories of stress and stressors. We can assume that some categories might be more salient to others, depending on the situation, the workplace, the environment, the type of work. As a communication scholar, I'm most interested in support and relationships, certainly, which are two categories that I'm going to spend a bit more time on. And before I do, I wanted to just give you that update, a little bit of background from the Stress at Work survey, which is the American Psychological Association's most recent survey on stress at work. And they typically do one of these each year. This was a United States sample with about 2,500 employed adults. It was conducted by the Harris Poll for the American Psychological Association in April of last year. So just about a year ago, pretty evenly split between genders, and it was distributed based on population statistics. So let's talk a little bit about what the results were. First of all, we know that based on the results, that well-being is a very high priority for workers, and of course that term well-being might be loaded, and so I want to just recognize that as something critical. But some things we do know is that 92% of workers said that it was very or somewhat important to them to work for an organization that values their emotional and psychological well-being. 92% said it was very or somewhat important to them to work for an organization that provides support for employee mental health. That's a pretty big number. 95%, so almost everybody, said it was very or somewhat important to them to feel respected at work. And I think that's critical because we know that respect links to a whole host of really positive outcomes. 95% said it was very or somewhat important to them to work for an organization that respects the boundaries between work and non-work time. So this paints an important picture of what workers value in terms of health and mental health in particular, and also the relationships at work. It also gives us insight into where workers believe there may be deficits in their workplace. So that said, about 77% of workers said they're satisfied with support for mental health, which is a good thing, but there definitely is quite a bit of space. And one area that we know that there is space for improvement is in burnout. The survey results show us that there's positive developments across workplaces and working types, but 55% of workers still believe that their employer thinks that the workplace is healthier than it really is. And so there's a mismatch between the organizational view of work and, of course, the workers' experience at work. And I think that is a consistent theme that we've heard through these presentations and these panels. And so some of the reasons why we see that burnout is high. First of all, it leads to emotional exhaustion. So 31% reported that they feel emotional exhaustion, that people didn't feel that they're motivated to do their very best. Maybe there's a desire to keep them to themselves, a desire to quit. So 23% said they have a desire to quit as an outcome. A lowered productivity, of course. Maybe they were irritable or angry with coworkers, or there was a feeling of being ineffective. So workplace stress remains at a concerning level, with 77% of workers having reported some sort of workplace stress in the last month at a high level. 57% indicated that they experienced negative impacts because of work-related stress. And so burnout, even though we believe that there's a lot of improvements being made in the workplace, especially after the return to work from pandemic, there is still high burnout. And quickly, burnout is, I think one of the best ways of describing it is that wearing out at work. One person who, of course, studies burnout exclusively and has really spent her entire career is Dr. Christina Maslach at Berkeley. And her colleagues really for the last few decades have studied this. It typically happens in this three dimension as a cascade effect. First, there is some level of emotional exhaustion where a dedicated employee distances themselves both cognitively and emotionally from their job and maybe their clients. That moves to depersonalization or cynicism, which is a defense mechanism. This is where communication focuses on the tasks and not the people, potentially cynical about their job. And that moves to a lack of professional efficacy, where the employee tends to not do their job as they used to do it. It's a cascade effect, usually starting in that emotional exhaustion space, which is the stress dimension of burnout. And that burnout leading, of course, to that lack of professional efficacy or departure from the job, absenteeism, or potentially presenteeism. Dr. Sarah Tracy from Arizona State University explored some of the causes of burnout from both the organizational perspective and the individual perspective. From an organizational perspective, there's of course role stress. So maybe the worker doesn't know what their role is in the organization, or they were given a role that's different than they originally thought it was going to be. So workload, both too much workload and too little workload, can lead to burnout. Surveillance from the organization, or the perception that there is a good surveillance or intense surveillance from the organization. Things like job satisfaction surveys, or customer satisfaction surveys, is one area we're starting to see quite a bit of link to burnout. Power and control factors. On an individual perspective, certain employees, might feel more or less burnt out based on their capacity for work, their coping skills, both in and out of the workplace, feelings of cognitive dissonance, so the idea of them not liking the work they're doing, their ability to have empathy for others. If there is an emotional contagion in the workplace, so maybe something happened and quite a few people are unhappy, that can link to emotional contagion. I think we're starting to see that quite a bit with layoffs. And of course, there are a variety of demographic factors. One interesting one is that younger employees tend to feel more burnt out than employees who have been at the organization longer. I think one of the reasons why is because there's more coping strategies. Now, burnout, of course, can lead to a toxic workplace, and I think that there's a clear link between these two spaces. So I want to point out that the percentage of workers based on the same survey that described their workplace as toxic was about 20%, 19%. But I think what's really interesting here is to look at where there's more toxicity, right? And it's in the type of work. So 26% of people who reported that their organization was toxic came from those who work in customer, client, or patient services. So people who work in that are more likely than office workers to characterize their workplaces as toxic. People who work in person were also more likely to characterize their workplace as toxic. And I think that makes sense given both the kind of work that's done in those customer, client, and patient service-facing jobs, and also in an in-person capacity. There's some demographic variables in thinking about toxic workplaces. More women than men report that their workplaces are toxic, and it's probably related to an experience level in those spaces. I think there's something to be said about gender role. That's, I think, critical in understanding workers' experiences at work. More people living with a disability reported toxic workplaces than without living with a disability. Employees working for nonprofit and government organizations were more likely to report a toxic workplace than those in private industry. I think that's interesting and telling. Those in upper management were much less likely to report toxic workplaces than those in middle management compared to frontline workers and individual contributors. And so the question really of thinking that mismatch between somebody who is in a leadership position and a frontline worker, that their views of reality might be very different, and maybe their attributions as to what toxicity comes from. So in thinking about this, I would like to spend just a bit of time talking about how communication can harm. And so this is really kind of that piece linking from toxicity. Where does it come from? One place could be verbal abuse. Workplace verbal abuse is pretty salient in nearly 1 in 4 workers. 24% experiencing verbal abuse. This is things like shouting, yelling, attacks, foul language, threats. The number increases in jobs that are customer, client, or patient services, and accounts for verbal abuse coming from customers, clients, and patients. And I think that's critical. And thinking about communication that harms, verbal abuse certainly is one of those spaces, where 31% from customer, client, patient service jobs reported experiencing verbal abuse. That can then link to bullying. Workplace bullying is a very dark side concept. When we think about verbal abuse, we can link it to something like bullying. And not all stress-inducing organizational concepts are negative, but this one certainly is. A quote from Pamela Lucken-Sandvik in 2003: "The supervisors who inflict psychological abuse on subordinates represent one of the most frequent and serious problems confronting employees in today's workforce." And I know that quote comes from some time ago. It hasn't changed in nearly 20 years, that there is still a serious problem in employees in experiencing bullying. And so I'll talk a little bit about the psychological implications of bullying. And to give you just a quick definition from Salin, that definition is that bullying is repeated and persistent negative action toward one or more individuals, which involved a perceived power imbalance and create a hostile work environment. Bullying is a form of interpersonal aggression. It's hostile. It's antisocial, and it happens in the workplace, sadly, pretty frequently. And here's the kinds of negative acts that have been reported from people who have been bullied or have witnessed bullying. Things like had information withheld that affected performance. all the way down to experienced threats of violence or abuse. And this is organized by target, so the person who received the bullying message, this is their percentage, and then non-target. And so you can see some of these are pretty frightening. Humiliated or ridiculed in connection with your work, gossips or rumors spread about you, been ignored or excluded or isolated, had key tasks removed, replaced with trivial or unpleasant tasks, subjected to excessive teasing and sarcasm. So this is what happens when people are bullied, and certainly the kinds of links we see about the degree of bullying linked to job satisfaction, linked to job rating, and linked to job stress is frightening. There's a very positive relationship between increasing levels of bullying in the workplace and people reporting stress. Of course, linking to burnout and all the negative, health-related outcomes. We look at this. Here's one very quick health-related outcome, exploring cortisol in saliva during the day for bullied and non-bullied respondents. The concentrations of cortisol were measured at awakening in 45 minutes, 8 hours. And what we see here is that the bully profile is not a healthy profile of diurnal cortisol response and doesn't match those respondents who reported not being bullied. And so bullying can be a major stressor for organizational members. And so it's just one negative communication-related act that happens in an organization. Bullying can certainly harm workers. One other area of research is something that I've studied, and that is the idea of co-rumination, or what happens when workers come together and they talk about their stressful experiences, and in doing so, they co-construct the stressful experience as worse than it really is. Very similar to what happens when you ruminate on a problem. I do this sometimes. And of course, at the end of my rumination, it makes that problem quite a bit worse. So this is when you do it with somebody else. And it is dyadic and it's communicative. It is frequently discussing problems, discussing the same problem repeatedly, mutual encouragement of discussing the problems, speculating about the problems, and focusing on negative feeling. It's just kind of a twilight concept. It's not dark or positive, but it is a concept that does harm workers. And some of the research I've done has showed that all the positive outcomes of social support, or much of them, can be removed to both burnout and perceived stress if people are engaging in a behavior of co-rumination. So when they're expressing to each other about all their negative feelings, that can actually increase burnout instead of reducing burnout. And the interesting thing about this is that workers believe that they're engaging in a supportive transaction, but the type of communication becomes more important than the amount of communication in this case. And then I'll end with just talking very briefly about communicatively restricted organizational stress. Communicatively restricted organizational stress is what happens when somebody feels like they don't have an outlet to discuss their stress. They don't have any support network, or they can't talk about their stress with others. Maybe, I'm going to talk about nurses in just a second. Maybe they're restricted by law, like HIPAA, for instance, in describing stressful experiences that they've had with a patient, with others outside of the work. And then in the work, they don't have a network to communicate with with others about their stress. We believe that my colleague Alice Wexler and I believe that cross is something that we don't really think about, because people say, "Oh, I have folks to talk about stress at work." But what happens when you say that you do, but your perception is such that you just can't? Maybe depending on the type of stressor, the type of situation, and so on. And this might be, also related to the culture of the organization. Some organizations just allow for more discussions of stress, and others do not. And so in a recent study, we looked at nurses in the US, a panel that we collaborated with Qualtrics on. We looked at a few things, of course, a measure of cross, nursing stress, effort reward imbalance. So what happens when people believe they're putting more efforts into their work than they're getting in rewards. Perceived organizational support. We looked at insomnia and diminished productivity and general health. We did some follow-up interviews too with some nurses. We discovered that there is a strong link between cross distress and effort reward. So when people feel like they have more stress related to communicatively restricted organizational stressors, it also increased their imbalance between their efforts and their rewards. And we're not sure which direction this is. Was the ERI related to cross or the other way around? It's hard to parse that association. There's a link to organizational support. There's a link to lost productivity between ERI and productivity. Cross-distressed was linked negatively to insomnia, which is interesting, but also perceived general health. So as cross-distress goes up, perceived general health goes down, and I think that's an important finding in this instance. We also discovered that there is a link between nursing stress, ERI, and cross distress. And so what we found is that those members who had the highest level of cross distress with the lowest level of organizational support had the highest level of nursing stress. So the interaction here was really important. It wasn't just one or the other. These pieces come together to really paint a negative picture of bad interactions at work, or at least a perception of bad interactions. We followed up with some interviews, and those interviews, in our interviews with nurses, we found that that there was a universal experience of stress. Nurses felt that there was a tremendous amount of workload, problems with communication and bureaucracy, patients and families, that they had trouble talking to people about their stress. So there's complexity, things like nobody gets it. And we have some really powerful quotes from some of the nurses that we spoke to. And then, of course, that they reported that their jobs just aren't as rewarding as they used to be. And part of that was because they don't have the network to talk to people about their stress at work. So we discovered that there was certainly some link between ERI and cross in our model. Here's a quote from one of our nurses, Orchid. Oh, they don't balance out at all, because you don't have as much accomplishment as you have kind of failures. So there's a feeling of lack of accomplishment for some of the nurses that we spoke to. Now, I did want to talk about how communication can heal, which is important for us to remember. So I do like ending this on a positive note, really not just talking about the toxicity in workplace, talking about burnout, talking about co-rumination, and of course, cross. But when we think about how to move from burnout to engagement, I think it's important to note that engagement is the opposite of burnout. How do we get engagement in a workplace setting? That could be increasing social support or demonstrating good quality social support, ensuring that there is a space for workers to be able to talk about their stress, talk about their experiences in a non-co-ruminative way, that there's participation in decision-making, that there's network integration, that we ensure that workers feel that they have a network. And this is really important when we're talking about remote work too. I know I spent a bit of time talking about in-person, but remote work is a place where there's a big potential for loss of connectivity because it is so remote, so remote, many people feel that they're disconnected. Toxin management. So how do we ensure that we try to remove, toxic behaviors, toxic communication, and then, of course, there could be some structural interventions that might be necessary. We think about organizational interventions. Biggs and colleagues conducted a quasi-experimental design with one organization where they conducted an upstream leadership intervention. The intervention dealt with supervisor-subordinate communication and social support. The specific topics that they used were education about leadership styles, effective communication, and strategic leadership. It was also coordinated with a 360 designed review program, and it lasted for 7 months. They found that the leadership development intervention had a positive effect on subordinates' perceptions of work culture support and strategic alignment, which in turn had a positive effect on their job satisfaction and their work engagement. So this research really demonstrates that organizational interventions aiming to enhance the upstream organizational resources can improve the psychological well-being of the workers themselves. And so there's definitely a space in thinking about how we can do some sort of work on the leadership space to improve the overall experience of all workers. And then another area is really thinking about social interactions. This was a meta-analysis done by Heafy and Dutton they proposed this model of positive social interactions, looking at these areas of the context of the organization, the practices, the culture, and the leadership, how that translates to the experiences of positive social interactions at work, how that then correlates to the physiological effects like the cardiovascular system improvement, immune system function, and neuroendocrine system, and then how that relates to physiological and resources and physical health. Those things then link directly to work engagement and work recovery. And so we think about the way that positive social interactions link to the positive outcomes. It's through a model very similar to this. Some other things that we might consider in thinking about how best to intervene or to improve, create healthy workplaces through good communication could be targeted interventions, finding ways to intervene in cultures that have more restrictedness or are experiencing more stress. If we look back at the findings from the APA study, we might say, well, maybe we need to think about how to create more interventions in those frontline workers who are working directly with the public, with customers, with clients, with patients. Maybe thinking about organizational culture work and training to improve the culture of an organization. And then I like to think about how we can be more responsive in communication networks. So reducing the perceived futility of communicating issues, that's important. And giving employees space to be able to talk about what's stressing them out, I think helps everybody. It helps the organization to understand what the stressors are, and it helps the employee to recognize that there is an outlet, a venue to be able to talk about stress. Thinking about how we create managerial action from workers when they do communicate about those stress situations, the things that are stressing them. How is their action? Because if there's no action, then it's going to continue to feel, futile to the workers. And then, of course, providing space for employees to decompress with each other. And I think it's nice to have that space to ensure that that space is not just a place for venting. And I want to point out, venting is not an unhealthy behavior. It can be healthy when done correctly, when it doesn't turn into co-rumination. So that's an important kind of piece there. It is really critical for us to think about all of the things that stress us out at work, knowing that stress can be very dangerous and very damaging, and how communication plays a role in both creating and causing environments that are stressful. So it's not just workload, not just the type of work. It's also how we relate to each other, and that's an important piece. And then also how we can create interventions that improve the worker experience through good communication. So thank you so much for listening today, and I'm looking forward to hearing questions in a bit.
Thank you so much, Dr. Boren. We will get back to questions